in India, the ethnic diversity is so huge that we have no idea what the immunological variation in India is. So we don't even know. So getting a unrelated donor registry set up in India is a formidable challenge. But we do have one thing which is abundant in India, which is births. A lot of Indians are giving birth to babies, and we throw away the placenta. Placenta is a good source of stem cells. And if we can take the stem cells from the placenta at birth and freeze them and store them, that can be of use to patients everywhere. Patients of Indian origin anywhere in the world, and patients in India, obviously, which is the primary place where this would happen.
Right there in Trivandrum, we have one of the best institute of molecular biology, known as the Rajiv Gandhi Center for Molecular Biology. And tomorrow, if you make a major breakthrough in stem cell molecular biology at the genomic or submolecular level, it will come from Trivandrum, Kerala, India. So far, the Kerala delegations have included a lot of gentlemen. But we all know that having lived in Indian society, if you really want to get something done, you should talk to the mother. For the first time, you see that 75% of this delegation consists of lady leadership. This is beyond my expectation. Government of India is talking about 33 and 1/3% representation for women in the parliament. Rajya Sabha approved it. It is pending in Lok Sabha and state legislatures. Kerala government has instituted 50% reservation for women in local body elections. A US university conferred an honorary degree on a Malayali woman, none other than Mata Amrudanandamayi. The State University of New York conferred its honorary degree on Mata Amrudanandamayi last month. And talking about Mata Amrudanandamayi, the language of the people of Kerala reverberated in the corridors of United Nations, not through Sri V.K. Krishna Menon, not through my friend Sri T.P. Srinivasan, who made an elegant career in United Nations, but through Mata Amrudanandamayi. She spoke to the UN in Malayalam. Of course, it's instantly translated. But your mother tongue echoed in the halls of UN through a Malayali woman. Starting from Anna Malhotra to Fatima Bibi become the governor of Tamil Nadu, to Kamacharian becoming the Jhansi Rani of Travancore Court, Mahatma Gandhi, all the way up to Amrudanandamayi. There is something unique about women leadership in Kerala. So I place a lot of trust, expectation, and hope for something to be accomplished through the efforts of this wonderful lady leadership who is here with us. I know they won't take things for granted. Talking about the stem cell transplantation, let me highlight a third dimension of this project. All of us are excited about the possibility of the human stem cell replacing the bone marrow of a patient who is getting treated for leukemia and a few other solid tumors also. But there is another dimension of that. It is the very same stem cell which can be triggered to become your heart cell. The very same stem cell can be tickled to become your brain cell. The fundamental research in stem cell biology is in full swing. A few years from now, chances are that we may be able to use the stem cell storage facility at the Malabar Cancer Center to supply plenty of myocardial cells for a patient who needs a new heart. Plenty of brain cells for someone who needs a new brain after attack by the Parkinson's or Alzheimer's disease. Plenty of hepatocytes or liver cells for someone dying of a liver disease. That's the potential of this scheme. The private sector is already in full swing. In Pune, Chennai, and Mumbai, you can store your cord blood stem cell for an initial cost of 1 lakh and an annual maintenance fee of 75,000 rupees. This is for you. If you have only one child and you want to make sure that this child, in the unlikely event of getting struck by a malignancy, needs a stem cell transplant, the rich can afford to do that. The beauty of the project at Malabar Cancer Center is a translation of the doctrine of Sri Narayana Guru. The private sectors only cater to the rich, the powerful, and the influential. Their motto is plain and simple. Sambattu kalathu taibattu vechal, aabattu kalathu kaabattu thinnam. When you have the money, if you can keep the seeds, at some time when you are in turmoil, you may be able to bear the fruits of those deeds.
And one of the first person to call was my good friend MVP. He said, it is great, all unreserved support for him is there. Then another exciting call came from this Harry Parameswaran, and he heads one of the best departments well known in the world for bone marrow transplantation. He said, here, everything I can do, I offer forward to you. And that was a great inspiration. Then again, I got in touch with Paulus. Paulus was calling almost every other day. We had to go forward. And he got in touch with our minister, and minister invited both of us, Paulus and me, to be there. And we had a good discussion, and we together participated in a TV program for almost 1 hour. And it was a great thing because doctors from around the world, oncologists, they were calling, this is a project, go ahead, do it. And not only that, patients' relatives who had to go through this valley of tears, they were calling, please do it. This is one thing, it definitely will be rewarded for a higher power. So here we are, and Harry Parameswaran has given all his offer, and if any other Indian is there who can bring this project into fruition, this is this man, Harry Parameswaran. So I'm really excited. And all this goes to the inspiration of this man, Paulus. Thank you again. I'm pretty sure. By the way, when we asked her to come here, she first reaction was, no, I will send another expert doctor from there, and probably also my secretary, health secretary also happens to be a doctor. No, you will have to come, because you have to come and see these places. And before that, she gets so many things, she gets here for a vacation or something like that. No, she came here, she has been working all these 7 days without sleep. We saw her, how she works. We're proud of her, proud of you, and it will come to fruition. Thank you very much. Thank you.
Thank you, Dr. Thomas. Now I'd like to introduce Mrs. Rafia Khan of Samar. Distinguished community members, first I must really compliment Mr. Paulos for putting all this together. He put the best team in this country and the best ministers from Kerala. He has created positive energy in this program. I have been working with India, mainly Bombay, Gujarat and Delhi, to initiate this program. It has started, as you know, but I feel there's more energy in this program. I did not understand anything you spoke, but there was determination and there was a lot of goodwill in this and sincerity. This is what we need to start such a program. I have been very closely involved with a few of these programs in India. And let me tell you to keep away from one thing, and that is ego. It's ego that does not let you go forward. And there is a lot of ego in us Indians. Anyway, I have great faith with such a distinguished team to get the whole thing started.
കേരളത്തിലെ നിർധനരായ ക്യാൻസർ രോഗികൾക്ക് മെച്ചപ്പെട്ട ചികിത്സാ സൗകര്യം ലഭ്യമാക്കാനുള്ള പദ്ധതികളുമായി ബന്ധപ്പെട്ട് മുമ്പേ നിശ്ചയിച്ചിരുന്ന അമേരിക്കൻ പര്യടനത്തിനെത്തിയ ആരോഗ്യമന്ത്രിയെ പതിവുകാല വർഷപ്പനിയുടെ പേരിൽ വിവാദത്തിലാക്കിയത് എത്ര അപലപനീയമാണ്. തങ്ങളുടെ രാഷ്ട്രീയ താൽപ്പര്യങ്ങൾക്ക് വേണ്ടി വസ്തുതകൾ വളച്ചൊടിക്കുന്ന മാധ്യമപ്രമാണിമാർക്കും മാടമ്പി രാഷ്ട്രീയക്കാർക്കും ഇതൊക്കെ പതിവ് ശൈലി തന്നെ. എന്നാൽ നെല്ലും പതിരും തിരിച്ചറിയാൻ വിവേകമുള്ളവരാണ് പ്രബുദ്ധ കേരളത്തിലെ മക്കളെന്ന് ഇക്കൂട്ടർ അറിയുന്നില്ല. ഈ സന്ദർഭത്തിൽ അഭിനന്ദനീയമായ പ്രവർത്തനങ്ങൾ നടത്തിയ അമേരിക്കൻ മലയാളികൾക്ക് സുപരിചിതരായ ഡോക്ടർ എം.വി. പിള്ള, ഡോക്ടർ റോയ് പി. തോമസ്, കൂടാതെ ന്യൂയോർക്കിലെ മഹാരാജ ഗ്രൂപ്പിൻ്റെ സാരഥികളായ പൗലോസ് അരികപുറത്തിനും അദ്ദേഹത്തിൻ്റെ സഹോദരങ്ങളായ ജോസ് ചെറിയാൻ ഇവർക്കുള്ള നന്ദി പ്രത്യേകം അറിയിക്കുന്നു.